Okay, tooth tip for today. I had a very interesting case. A young man had a crown done on an upper right tooth, tooth number 3. All of his teeth look really good, but this crown came off. He said he had it done 3 months ago. So he had the crown in a Ziploc bag. He gave it to me. There was cement inside the crown. I looked at the crown. It looks like it was made out of zirconium. So I looked inside the mouth, and what did I see? I saw a tooth prep. That's dental terms, what I like to call a stump, a tooth stump. The tooth stump was very short and very tapered, tapered meaning like a teepee. So the reason why I was talking to him was because it doesn't matter how strong a cement I have, the crown, if I were to re-cement it, would still come off. And then he actually said, well, actually, the crown came off when I was flossing. One other problem with the crown that was previously made was that it had a lot of overhangs or over contour or bulk. Basically, if you have a tooth like this is your tooth, you want the crown or the restoration to be really flush or just a little bit flush, okay? You don't want it bulky, because when it's bulky, you get floss in there and it could push it off. So what I was discussing with him was we don't want to put this crown and cement on, and if it comes off, I just didn't want it to be my fault. So after a long discussion, and he asked what the costs are for a new crown, I said, let's go ahead and consider that. So he went ahead and paid for his treatment. Fortunately, we had time today to do it. Since we have CEREC technology has been around for 30 years, through CAD/CAM design, computer-aided design, computer-aided machinery, we're able to do this restoration in one visit. Now, going back to why the crown was coming off, you need to look at several things. Number one is the stump. So if you have a stump with what they call parallel walls, so this is your stump like this with walls that are straight up and down, and your stump is tall, okay, let's say it's a couple millimeters tall, the chances of a crown sitting on top of it are better. So when you have a taper like this, there's nothing for the crown to grab, so it can come off. The other thing you need to look at is if the tooth looks like it's good sound tooth structure, because if it's not, then you have to remove that. It could be decayed. So we would have nice sound tooth structure, and then you have to consider the cement and the crown itself. Let's talk about the cement. There are really two types of cement. There's a cement that's a traditional cement, which just hardens up, and then the other cement, which is a resin or a bonding cement. So there are different bond strengths. So this cement should bond to the tooth and to the crown. Now, let's talk about the crown. The crown, there are different materials. You see, zirconia is a lot stronger and more durable. However, it doesn't bond well. So it's better, zirconia is great for strength, and if you have a tooth with a stump that is nice, parallel, and tall. The zirconium is bad when you want to bond. Because of its strength, it is hard to get these nooks and crannies and etching them. So when you have a zirconium crown, they're much harder on tapered tooth. So in this case, it's either the cement or the taper of the stump or the material of choice for the crown. Other crowns you can actually bond well to. So if you have a flat tooth or a tapered stump, then you may want to consider a bonded restoration that bonds well using a bonded cement. So what we've done today is, what we did this morning was actually fabricate a porcelain feldspathic tooth or a crown in order to etch it, and we use a bonded resin cement to bond. I did not drill more on the tooth, because what I could have done was drill away more tooth and make the taper more straight up and down and flatter, however, and taller. But in order to do that, I would have to drill closer and way below the gum line. And every time you have a margin below the gum line, it collects more bacteria, then it's harder to clean, and then you're more likely to get gum disease. You're also, when you're drilling on the tooth, getting closer and closer to the nerve. So if you know me and nerves, I like to minimize the amount of drilling. I like to make sure that the drilling doesn't go too fast or heat up the tooth too much, because I don't want the nerve to die. I don't recommend root canals. I don't do root canals. I pull out a lot of teeth that have root canals. So I want to conserve as much tooth structure as possible. So I would rather risk having the cement fail or the crown fail rather than the tooth fail. So these are my philosophies at the office when it comes to crowns. One final thing I want to note. When you're doing crowns, if you can avoid doing crowns, all the better. A lot of insurance companies pay more or reimburse more for a crown than a filling. See, what most dentists do is when the filling is small or medium, or the cavity is small or medium, they'll do a filling. If it's larger, they'll do a crown. But when the insurance factor comes in, and the dentist will get paid more if they do crowns, they're more likely to recommend crowns. And when they're recommending crowns, what they do is they remove more tooth, sometimes unnecessarily. Unfortunately, in the case this morning, I do think that the crown was recommended way too early, and now we can't get back any enamel. Now we're risking damaging the tooth, losing the tooth, possible root canal, all of those issues because of over drilling. So don't get caught into a trap of going to the dentist who is just looking out for their best interest or trying to figure out how to get reimbursed and taken advantage of the insurance and or you, the patient. Hopefully this information helped you today when it comes to crowns, and also what goes through the mindset of a dentist when recommending crowns.